So, hello students. Let us discuss something about the face. The face is a very important topic, and what is very important in the face is the motor nerve supply, venous drainage of face, sensory nerve supply, and the arterial supply of the face. Yes. So, let us first begin with the motor nerve supply of the face. Students, the motor nerve supply of the face, have a look at this. Now, these are the muscles of facial expressions, correct? These are all the muscles of facial expressions, and all these muscles of facial expressions are derived in which pharyngeal arch? Yes, any guesses? The second pharyngeal arch, correct? So all these muscles of facial expressions are derived from the second pharyngeal arch. And which is the nerve of the second arch? Any guesses? That's facial nerve. The nerve of the second arch is the facial nerve, and all these muscles of facial expressions are therefore supplied by which nerve? Facial nerve. So motor nerve supply of the face would be the facial nerve. And students, the facial nerve, as it gets out of the skull, which is that foramen through which it gets out. Yes, the stylomastoid foramen, correct? So the facial nerve gets out through the stylomastoid foramen, enters a gland here. Yes, what is this gland? The parotid gland. Enters the parotid gland and then gives this 5 branches to supply these muscles of facial expressions, correct? So these are the muscles of facial expressions. And what are the 5 branches of facial nerve? One, temporal, zygomatic, buccal. One runs along the margins of the mandibular. What's that? Marginal mandibular, right? And the last one goes in the neck to supply this muscle of the neck. Any guesses, Bacho? What is this muscle of the neck known as? Yes, this is the platysma. And this branch of facial nerve which comes down in the neck to supply the platysma is the cervical branch of facial nerve. Cervical branch, correct? So what are the 5 branches of facial nerve as it emerges out of the parotid gland? One would be temporal, the second would be zygomatic, the third is buccal, the fourth runs along the margins of the mandible, that's the marginal mandibular, and the last one is the cervical branch of facial nerve. And this cervical branch of facial nerve is, what does it supply? The platysma muscle. Platysma. Perfect, students? Remember, that's a very important MCQ also for you. So one of the following branches of facial nerve supplies the platysma. That's the cervical branch. Correct. Now, let us come to the venous drainage of the face. Venous drainage. I'll draw a slide for you, students. This venous drainage of face is extremely important. Why? Because infection from this, there's a part of the face which is known as the dangerous area of the face. Any guesses? The lower part of the nose and the upper lip. The lower part of the nose and the upper lip, this part is known as the dangerous area, and any infection from this dangerous area directly enters a sinus inside the skull. What's that? The cavernous sinus. Cavernous sinus. So infection from the dangerous area goes to the cavernous sinus. It may lead to cavernous sinus thrombosis. We'll see the cavernous sinus later, but students, understand the venous drainage of the face, a very important topic. Let me begin with this. So I'll draw a slide for you. Have a look at this. I'll draw a slide for you for the venous drainage of the face. Okay. So that's a slide. What is this for the mandible and what is this for the mandible? Yes, any guesses? That's the body of the mandible and that's the ramus of the mandible. The body and the ramus. And what is this junction of the mandible known as? That's the angle of the mandible. Very correct. So that's the body of the mandible, that's the ramus, and that's the angle of the mandible. Okay. Now coming to this venous drainage of the face, just understand this, students, a very important topic for you. I'll start it like this. Have a look. There's a vein above the orbit. What do you call this vein above the orbit? As supraorbital vein. And there's a vein here. Now, this bone is the frontal bone, right? That's a frontal bone. And the frontal bone has got a pulley here. Pulley. What is the pulley known as? Trochlea. Trochlea. So this vein which comes from here is the supratrochlear vein. So supraorbital above the orbit, and there's a vein, supratrochlear vein, together joins to form a vein, at the medial angle of the eye. So that's the medial angle of the eye here. This vein which is formed at the medial angle of the eye here is known as the angular vein. Angular vein. So supraorbital supratrochlear joins to form the angular vein. Now this angular vein continues down as what? What is this vein going to be? That's the facial vein. Facial vein. Fine. Now let us understand this. You tell me now. This is the ear here. That's the ear. Huh? Now there's a vein which comes from the temporal region. What is this vein coming from the temporal region? Here. That's the superficial temporal vein. And there's a vein coming from the maxilla part. What's that? Maxillary vein. Correct. So superficial temporal and maxillary joins to form a vein here. And this vein is formed behind the mandible. Any guesses? What is this vein known as? The retromandibular vein. Retromandibular vein, correct? So superficial temporal and maxillary joins to form the retromandibular vein. Now this retromandibular vein divides into an anterior and posterior divisions. Anterior and posterior divisions. Right, this anterior division of retromandibular joins with the facial vein to form a vein which is known as the common facial vein. And this common facial vein is going to drain into the internal jugular vein. Internal jugular vein. The posterior division of retromandibular vein joins with a vein coming from behind the ear. Any guesses what is this vein? That's the posterior auricular vein. So the posterior auricular vein joins with the posterior division of retromandibular vein. And what is this vein formed? External jugular vein. And this external jugular vein drains into the subclavian vein. Subclavian vein. So just remember this. This is the venous drainage of the face. Right, students? Let me label this for you. I'll label this. You can have a look at this. Fine. So this vein is the supratrochlear. Supratrochlear. This is the supraorbital. What is this? Angular. Angular. What is this vein? Facial. Facial. What is this vein? That's a superficial temporal vein. And what is this vein? Maxillary vein. Superficial temporal and maxillary. What is this vein? This vein is formed behind the mandible. So that is what we call as the retromandibular vein. Retromandibular vein divides into an anterior and a posterior division. Okay, so I'll make this as anterior division and I'll make this as the posterior division of retromandibular vein. So anterior and posterior division. The anterior division of retromandibular joins with the facial to form the common facial vein, and this common facial vein drains into the internal jugular vein. I hope this is clear. Right. So what is this vein now, students? That's the posterior auricular vein. Posterior auricular vein joins with the posterior division of retromandibular vein, and this vein which is formed here is the external jugular vein, drains into subclavian. Is this clear to all of you? Have a look at this slide, students. Have a look at this slide. Okay, I'll show you on this slide. Have a look at this slide. So let me label this for you. Right? What is this vein? This is number 1. I'll put this as number 1. I'll put this as number 2. So number 1 is supraorbital. Number 2 is supratrochlear. What's this number 3? Angular vein. What's this number 4? Facial vein. What is this number 5? If this comes as a visual slide for you, that's the superficial temporal. The vein which comes from here, that's a maxillary vein. What is this? Retromandibular vein. Okay, this is the retromandibular. This is the anterior division, and that's the posterior division. Anterior division joining with facial vein to form, what is this vein? Common facial, drains into internal jugular vein. Right, I hope you can see that. Drains into internal jugular. That's internal jugular vein. The posterior division of retromandibular vein joins with the posterior auricular. And what is this vein which is cut here? The external jugular vein. And this external jugular vein is going to drain into, yes, the subclavian vein. Clear to all of you? Fine, perfect, students. That's the venous drainage of the face. Be very clear about this. Now, coming to this, which is the dangerous area of the face? The dangerous area of the face. Okay. The dangerous area of the face is the lower part of the nose. One moment, where is that slide gone? Okay. So dangerous part of the face is the lower part of the nose and the upper lip. The lower part of the nose and the upper lip, that part is known as the dangerous area of the face. And this is known as the dangerous area because infection from this area directly goes to a sinus. What is that sinus? The cavernous sinus. Cavernous sinus. Now, how does the infection from this area go to the cavernous sinus? Let us understand this. How does the infection from this dangerous area go to the cavernous sinus? Okay, that's fine. So just have a look at this. How does the infection from this dangerous area go to the cavernous sinus? Let me just draw this once again for you. Okay. I'll just draw this once again for you. This is the ramus. That's the ramus. That's the body of the mandible. That's the angle of the mandible. Coming to the veins here. Here, that's a supraorbital, that's a supratrochlear, that's a angular vein. Angular vein continues as facial vein. That's a superficial temporal, that's a maxillary joins to form the retromandibular anterior posterior divisions. Anterior division joining with facial to form the common facial vein drains into internal jugular vein, and the posterior division joining with posterior auricular vein. That vein is the external jugular vein. This drains into the subclavian vein. Perfect. Now, which is the dangerous area of the face? Students, the lower part of the nose and the upper lip. Now, this part of the face is known as the dangerous area of the face. Why? Because infection from this area directly goes inside the skull in a big sinus inside the skull, and that is what we call as the cavernous sinus. Let me just draw the sinus here inside the skull. That's the cavernous sinus. How does the infection go to the cavernous sinus? Okay, I'll start. Just have a look. From the dangerous area, infection first goes to this vein. What is this vein now? That's the facial vein. From the facial vein, now these veins are valveless. So infection goes in a reverse direction. From the facial vein, it goes in a reverse direction here. What is this vein? That's the angular vein. And from the angular vein, there's a vein which directly goes to the cavernous sinus. There's a vein which communicates with the cavernous sinus. And this is what we call as the superior ophthalmic vein. Superior ophthalmic vein. So, dangerous area of the face, facial vein, angular vein, superior ophthalmic vein, and the cavernous sinus. That's one way of spread of infection. Now, there's one more way of spread of infection. Students, just tell me, what is this for the mandible? Body, and what's this? Okay, here you see, what's this for the mandible? Body, and what's this for the mandible? Ramus, right? That's the body, and that's the ramus of the mandible. What is this junction known as? Angle of the mandible. Perfect. What is this fossa known as? Temporal fossa, right? That's the temporal fossa. We remove the ramus, and we go deep to the ramus. We come to another fossa. Any guesses? Right, look, that's the ramus. We remove the ramus, we come deep to the ramus. There's another fossa here, and this fossa is lying deep to the temporal fossa. This is what we call as the infratemporal fossa. Infratemporal fossa. So that's the temporal fossa. We remove the ramus. Deep to that is the infratemporal fossa. In this infratemporal fossa, there are two muscles of mastication. Any guesses? Come on, students, any guesses? There are two muscles of mastication in the infratemporal fossa. Anyway, which are the muscles of mastication? There are four. This here, outside here, here, that's a temporalis. The muscle attached to the angle here, what's this? Masseter. So temporalis and masseter are outside. Which are the two muscles left? The lateral and the medial pterygoid. And where does this pterygoids lie? In the infratemporal fossa, correct? But students, we are not able to see these pterygoids. We are not able to see because these pterygoids are surrounded by a plexus of veins. There's a plexus of veins which surrounds the pterygoids, and that is what we call as the pterygoid venous plexus. I'll show you the slide. Okay, so we remove the ramus of the mandible. The first thing that we see is a plexus of veins. That's the pterygoid venous plexus, and deep to this plexus are the medial and the lateral pterygoids. So students, let me draw this pterygoid venous plexus here for you. For your understanding, I draw this as the pterygoid venous plexus here, just for your understanding. So how does the infection from the dangerous area of face go to the cavernous sinus? There's one more way. From the dangerous area, the infection goes to this vein. What is that? Facial vein. From the facial vein, there's a vein here from the facial vein, there's a vein here. This is what we call as the deep facial vein. Deep facial vein, from the deep facial vein to the pterygoid venous plexus, right? And from the pterygoid venous plexus, there's a vein which directly goes to the cavernous sinus. Any guesses? Now, these are the veins which connects the veins outside the skull with the veins inside the skull. And these are what we call as the emissary veins, right? So once again, dangerous area of face, facial vein, deep facial vein, pterygoid venous plexus, emissary vein, cavernous sinus. I hope this is clear to all of you. Yes? Perfect. So once again, dangerous area of face. How does the infection go to the cavernous sinus? There are two ways. One, facial vein. From the facial vein, there are two ways. Angular vein, superior ophthalmic vein, cavernous sinus. Second, dangerous area, facial vein, deep facial vein, pterygoid venous plexus, emissary vein, cavernous sinus. Let me just write this down for you. Okay, this is extremely important. And have a look at this slide now, students. Look at this slide. Okay, what is this now? Let me just draw this for you. One moment. Let me just. Okay, what is this for the mandible? That's the body. And what is this for the mandible? Ramus, right? That would be the ramus. Now we've removed the ramus. We have removed the ramus of the mandible. What is this fossa? That's a temporal fossa. Now what is this fossa? Infratemporal fossa. What is this plexus of veins that you're seeing here? That's the pterygoid venous plexus. And deep to the pterygoid venous plexus, yes, those are the pterygoids. Very good. Those are the pterygoids. So how does the infection go from here to the dangerous area? Let me just write this down for you. So we'll write it like this. Dangerous area of the face. So dangerous area of face. Dangerous area of the face is which one? The lower part of the nose and the upper lip, right? So the infection first goes to facial vein. From the facial vein, there are two ways of spread of infection. One is angular vein, superior ophthalmic vein, cavernous sinus. Okay, that's one way. Coming to the second way, facial vein. What is this vein? Deep facial vein, pterygoid venous plexus, emissary vein, and cavernous sinus. Same, cavernous sinus. Clear? I hope this is clear to all of you. A very important topic this is. Answer this MCQ. So dangerous area of the face is so called because of its connection to the cavernous sinus through. Any guesses now? Now you should be able to tell me. Yes, what is the answer for this? Yes, students, the answer is the superior ophthalmic vein. Perfect, perfect, very good. Excellent, right? So that's about the venous drainage of the face. So students, we have finished with the motor nerve supply of the face. We've finished with the venous drainage of the face. Let us understand the sensory nerve supply of the face. Sensory nerve supply. Now, can anyone tell me which is the nerve which is going to supply sensory supply to the face? The entire face sensory nerve supply is by the trigeminal nerve. Trigeminal. And now students, we know there are three branches for the trigeminal nerve. This much part of the face is supplied by whom? The ophthalmic division. This much part is supplied by the maxillary division, and the lower part of the face is supplied by the mandibular division of trigeminal nerve. Clear to all of you? So the entire face is supplied by the trigeminal nerve through its three divisions: ophthalmic, maxillary, and mandibular, except, there is always an exception to it, except the skin over the angle of mandible. Look at that. The skin over the angle of mandible, and this is supplied by the greater auricular nerve. Greater auricular nerve. And this greater auricular nerve is a branch of a plexus here. A plexus formed in the neck. What's that? Yes, cervical plexus. Excellent. Very good. So the entire face is supplied by the trigeminal nerve through its three divisions, except the angle, the skin over the angle of mandible, which is supplied by greater auricular nerve, which is a branch of cervical plexus. Perfect. Is this clear to all of you? Very good. Let me just draw this. Look, we say ophthalmic, maxillary, and mandibular. but it is not the main ophthalmic maxillary mandibular. These are the branches of ophthalmic maxillary mandibular nerve which are going to supply the face. Let us have a look at this, students, which are these branches of ophthalmic maxillary and mandibular which are going to supply the face. Okay, just have a look at this. Okay, let me draw this for you once again, students. Right. You should be able to understand all the slides. So let me draw this for you. That's again the body of the mandible. That's the ramus of the mandible here. Now, who supplies this part of the face? This much part of the face is supplied by which division? Ophthalmic. This part of the face is supplied by the maxillary, and this part of the face is supplied by the mandibular division, except this area is supplied by the greater auricular nerve. Greater auricular nerve. You can see this, no? So greater auricular nerve is a branch of a plexus. We'll see this later in the later lectures. A plexus formed in the neck, that's the cervical plexus. Okay, students, let us understand the details of this. Let us understand the nerves, each nerve which is going to supply this. Okay, let us have a look. So coming to the ophthalmic division of the trigeminal nerve. That's the nerve here about the orbit, same as that of the vein, which is this supraorbital. And there's a nerve here. What's that? Supratrochlear. So same, supraorbital and supratrochlear nerves. These are branches of ophthalmic division of trigeminal nerve. I hope you're getting this. What is this nerve? This is just below this. So this was supratrochlear. So this is infratrochlear. The nerve which supplies the tip of the nose, that's a very important MCQ. The nerve which supplies the tip of the nose is external nasal. And there's a gland right here, that's the lacrimal gland. And the nerve supplying the skin here, that's the lacrimal nerve, right? So this is supraorbital, that's supratrochlear, that's infratrochlear, that's external nasal, and that's lacrimal nerve. Clear? So these are the branches of ophthalmic division. Coming to the maxillary division of trigeminal nerve. Students, if you can tell me maxillary division. Yeah. Now, that's the orbit, correct? And just below the orbit, we have a foramen here. Any guesses? Just below the orbit, we have a foramen here, the infraorbital foramen. And the nerve which gets out from here is the infraorbital nerve. Infraorbital nerve, in fact, is a continuation of maxillary nerve. Clear? Now, there's a nerve which supplies the skin over the auricle, over the zygomatic region, zygomatic and the face, zygomatic area and the face, name zygomaticofacial. And there's a nerve which supplies the skin over the zygomatic and the temporal region, name zygomaticotemporal nerve. So what are the branches of maxillary division? This is infraorbital, that's the zygomaticofacial, and that's the zygomaticotemporal nerve. Am I clear? Coming to the mandibular division of trigeminal nerve, mandibular division. Yeah, there's a nerve here. What is this foramen here? Mental foramen. The nerve which gets out from here is known as the mental nerve. There's a nerve which supplies the skin over the auricle and the temporal region. Any guesses? Auricle and the temporal region. Yes, that's the auriculotemporal nerve. And there's one more nerve, a branch of mandibular nerve. Students, mandibular nerve will be studying in details later, but this branch of mandibular nerve supplies the skin over the buccinator. Which is buccinator? This is the buccinator muscle. And it supplies the skin over the buccinator muscle. What is this nerve? That's the buccal nerve. So what are the branches of mandibular division? That's the mental, that's the buccal, and that's the auriculotemporal nerve. Auriculotemporal, correct? So this is the entire sensory nerve supply of the face. So this is mental, this is buccal, and this is the auriculotemporal nerve. What is this nerve? This is infraorbital, that is zygomaticofacial, and that's a zygomaticotemporal nerve. So the entire face is supplied by trigeminal nerve except the skin over the angle of mandible, which is supplied by greater auricular nerve, and that's a branch of cervical plexus. Come on, students. This slide is specially for you. Can you answer this? Sensory nerve supply now? Okay, okay, yes, 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 yes. Quickly, quickly, quickly. Just one moment. Quickly tell me the sensory nerve supply of the face. Yeah. So what is this number one? Supraorbital. That's supratrochlear. That's angular. That's external nasal. And this is lacrimal. What is this? This is infraorbital, zygomaticofacial, zygomaticotemporal. This is mental, this is buccal, this is auriculotemporal. And what's this? Greater auricular nerve. Greater auricular. Perfect. Very good. Very good. Very good. Very good. So answer this. A very important MCQ for you. Skin over the angle of mandible is supplied by the greater auricular nerve. I hope I'm clear. Very good. So we're discussing the face. We have discussed the motor nerve supply. We've discussed the venous drainage of the face. We have discussed the sensory nerve supply. And coming to the last, the arterial supply of the face. Students, any guesses? The artery supplying the face. Yes, the facial artery. Facial artery. And this facial artery is a branch of, yes, can anyone tell me? This facial artery is a branch of external carotid artery. External carotid artery. So external carotid artery, the anterior branch. The first anterior branch is superior thyroid. The second is lingual. And the third one is facial artery. So the facial artery is a branch of external carotid artery. Now this facial artery lies between the mandible. Okay, I'll just make it like this. See if you can understand this. This facial artery lies between the mandible, if that's the mandible, and there's a gland here. What is this gland here? That's a submandibular gland. That's a submandibular gland. So this is the submandibular gland and this is the mandible. The facial artery is given here. The facial artery is given here. The facial artery goes over the submandibular gland. Now comes to lie between the submandibular gland and the mandible, right? So the facial artery is given deep inside. It's given deep to the submandibular gland. It goes above the submandibular gland. It comes to lie between the submandibular gland and the mandible, and now it gets out here. Now it gets here. And Bacho, can you tell me, students, what is this muscle here? What is this muscle which is attached to the angle of the mandible exactly here? That's the masseter. That's the masseter. And right at the anterior border of masseter, if I feel here, if you feel on the anterior border of masseter, what is the artery that you feel? Yes, the facial artery. So where do we feel for the facial artery? At the anterior border of the masseter muscle, right? So facial artery is a branch of external carotid artery. The facial artery forms a S-shaped loop. You can see this S-shaped loop. That's the loop of facial artery. It goes over the submandibular gland, lies between the submandibular gland and the mandible, and gets out here, gets out at the anterior border of the masseter. Now this facial artery is very tortuous, right? It's very tortuous. It goes towards the medial angle of the eye, and at the medial angle of the eye, it is going to anastomose with another artery. It is going to anastomose with another artery. We'll see this. Okay. So what are the branches of facial artery along its course? I hope facial artery is clear. Branch of external carotid forms an S-shaped loop over the submandibular gland, gets out on the mandible at the anterior border of masseter, very tortuous in its course, goes towards the medial angle of the eye, anastomosis with a branch of internal carotid artery. Now this facial artery has two sets of branches. One is one moment, I'll just write this down for you. Okay, you can see this. So what would this muscle be here? That would be the masseter, and the facial artery is here. It's very tortuous. It goes towards the medial angle of the eye. So we divide the facial artery into two parts. One is the cervical part and the other one is the facial part. What are the branches of facial artery in the cervical part? Okay, I'll just write it down for you. Cervical part. What are the branches of facial artery in the cervical part? One is ascending palatine. Ascending palatine artery. Ascending palatine artery, that's a branch of facial artery, right? Second is the tonsillar branch. Tonsillar branch is going to supply what? It is going to supply the tonsil. So one is ascending palatine, second one is tonsillar branch, third is the submental artery. Submental artery, and fourth is the glandular branches. Glandular branches are to the submandibular gland, right? So ascending palatine, that's a branch of facial. The tonsillar branch, that's the main artery supplying the tonsil, which is a branch of facial. The submental artery and the glandular branches. This is the cervical part. Now coming to the facial part. Have a look at this, bacho. What is this artery? It is going to supply the lower lip, so inferior labial. What is this artery going to supply the upper lip? That's the superior labial artery. One is the lateral nasal, and finally the last branch, the continuation, is known as the angular artery. This continuation of facial would be known as angular artery. So what are the branches of facial artery in the face? So let me just write this down. Can you see this? Yes, I'll write it here. Facial part. So facial part, what are the branches? Superior labial, inferior labial, lateral nasal, and angular. Lateral nasal and angular branch. So superior labial, inferior labial, lateral nasal, and angular branches. Am I clear to all of you? Just let me tell you one thing. At the medial angle of the eye here, there's an anastomosis between two main arteries. One is the external carotid, the other one is the internal carotid artery. Now, which branch of external carotid is going to anastomose here? The facial artery. And which is that branch of internal carotid? The superior ophthalmic artery. Okay. Superior ophthalmic artery. These are the two arteries which are going to anastomose at the medial angle of the eye. So facial artery with the dorsal nasal branch of ophthalmic artery. It's the dorsal nasal branch of ophthalmic. Okay, students, so let me just put this down for you on the paper. Anastomosis at the medial angle of the eye. Anastomosis at medial angle of the eye. Yes, it's between two arteries, right? It's between two arteries. One is external carotid artery and the other one is internal carotid artery. Clear? Now, which branch of external carotid is it? Facial. And which, it's a continuation of what? Which branch of facial? Or it's a continuation of facial? That's angular artery. Clear? And internal carotid artery, which is that branch ophthalmic artery, and the branch of ophthalmic is dorsal nasal branch. In other words, students, at the medial angle of the eye, there's an anastomosis between the angular artery, which is a continuation of facial, which is a branch of external carotid, with the dorsal nasal branch of ophthalmic artery, which is a branch of internal carotid. So students, I hope things are clear to all of you. We have done the face, we have understood the motor nerve supply, the venous drainage, the sensory nerve supply, and finally the arterial supply of the face. Students, I hope this topic is clear to you. In case of doubts, do get back to me. Thank you.